Good morning, everyone, and welcome to NAHDO's 35th annual conference. We want to thank you all for joining us, especially under these unique circumstances. I'm Norm Thurston, Executive Director of the National Association of Health Data Organizations, or NAHDO. First and foremost, I want to recognize our sponsors. In addition to those displayed on the screen, I want to recognize HCUP, who is one of our portal sponsors, and the following session sponsors that are noted in the agenda: Comagine Health, the Healthcare Cost Institute, the Mercatus Center at George Mason University, and Symphony Care. I hope you will all have an opportunity to express your appreciation to our sponsors personally during the conference. We will now proceed with our daily opening plenary session. The plenary session is sponsored by Onpoint Health Data, a Gigabyte sponsor and a NAHDO featured partner. Thank you, Onpoint. In addition to our sustaining members, NAHDO is fortunate to have 5 corporate partners. The collaborating partner is our highest level partnership. We recognize Milliman Med Insight as our collaborating partner. NAHDO also has 4 featured partners: Friedman Healthcare, Human Services Research Institute, Onpoint Health Data, and Optum. I'd like to take just a minute to give you the core data about the conference. As of Saturday, we had 410 participants from 36 states representing 107 organizations. All of these have shattered NAHDO's previous attendance records. I would also like to note that 55% of you are first-time attendees. We hope you will feel welcome and that you will have a chance to network with others that can help you with your program's goals. Here's a few pro tips for some of our attendees. Recognizing that this platform may be unfamiliar to many of you, we have added some helpful documents to the conference website. If you haven't already done so, we hope you will visit nahdo.org/annual_meeting to download the conference program and attendee guide and the agenda at a glance. In order to encourage networking and participation, we have added 2 types of fun games that can help you qualify for the prize drawings. First, the daily puzzles are available on the conference website. These are intended to give you an excuse to network and to work with people from other organizations as you solve them. Daily puzzle number 1 is already available. You can join the daily puzzle meetup during the midday break to find others who are working on the puzzle and share in the fun. Each day's successful puzzle solvers will be entered into a drawing for an Amazon gift card. The more people you work with, the more chances you have to win. In addition to the networking puzzles, the Excel Events team has built a participation game. Each attendee gets points for actively participating in the conference. Details on how to get points are located in the attendee guide. The leaderboard is displayed in real time on the lobby. One of the most important reasons any of us attend a conference is to expand our network and to meet new people. In the platform, there are 4 types of networking opportunities that we've incorporated. Meetups are sessions where each attendee is paired with one other attendee for a 3-minute session. Networking sessions are workshops of about 20 people who share a common interest and can meet up to discuss a particular topic. We'll be doing those on Tuesday afternoons. We hope everyone will visit the exhibit hall to meet representatives from our exhibitors. You can also set up a time to meet and download information. And finally, in the lobby, you will see a link that allows you to see all of the attendees and request to connect with them. Once they accept, you will be able to exchange information and even conduct a one-on-one video call inside the platform. In addition to this being NAHDO's first fully virtual conference, it is historic in other ways. We had originally planned to co-locate with the National Academy of State Health Policy in Boston, and in the change to a fully virtual conference, some of those plans got changed. However, we are still co-locating in the sense that our dates are coordinated and we will schedule 2 crossover sessions. To join one of these special crossover sessions, you must enter through the NAHDO portal instead of the NAHDO portal. You should have received an invitation this morning from NAHDO with details on how to join those sessions. Last but not least, I want to recognize and thank the NAHDO board, the planning committee, and the many session organizers who put in hundreds of volunteer hours in total to make this conference happen. As a token of our appreciation, we sent them all a special gift, a NAHDO 2020 commemorative face mask. This will help you remember that they are keeping your data and you safe. I will now turn the time over to our board chair, Karynlee Harrington. Karynlee is the executive director of the Maine Health Data Organization and a fabulous supporter. Karynlee, It's all yours.
Thank you, Norm. So on behalf of the NAHDO Board of Directors, it's my honor to welcome you all to NAHDO's first virtual annual meeting. Like so many organizations, the NAHDO Board was concerned about the effects of transitioning from our in-person annual meeting to a virtual one. And I think based on the stats Norm just provided, I think we can safely say that the meeting content, speakers, dependable sponsors, new interested sponsors, and the technology that can connect us are what's most important. So to reiterate what Norm just said, thank you. Thank you for all of you for your spending limited time with us. We know that everybody's crazy busy, so the fact that you're here with us is fantastic. And a big thank you to our conference co-chairs, Pat Merriweather and Craig Schneider, and to the members of the conference steering and conference planning committees, and to Norm and his team for their leadership and the countless number of hours that they've put in to prepare all of us for this event. Without everyone's support and guidance, this event would not be possible. As we all know, access to comprehensive, timely healthcare data is essential to produce meaningful analysis in pursuit of improved health and healthcare quality. The theme of NAHDO's annual meeting, Building a Bridge Between Data and Policy, could not be timelier. Both the opioid crisis and now the COVID-19 pandemic emphasize the importance of a strong health data infrastructure that can be accessed to inform policy at all levels, state, local, regional, and national. As my dad used to say to me, with great challenges comes great opportunity. And I think there's plenty of opportunity. In a recent Health Affairs blog post, the authors discuss how all payer claim databases can provide the robust statewide data needed for an effective national response to the pandemic. Today, there are 18 states operating all payer claim databases and several states that are in the process of development. There are entities that are not part of state government that are collecting claims data on a voluntary basis. Additionally, most states collect inpatient and outpatient hospital encounter data. There are health information exchanges that collect clinical data across our country. Hospitals send data regarding rates of healthcare associated infections to a federal repository, and many states also collect HAI rates. There are state cancer, death, and birth registries, and there are many other disparate healthcare data sets. My point is there's a great deal of healthcare data that's currently collected throughout the country. However, most of it's siloed and it's not integrated to where it could reach its greatest potential. So where is the opportunity? For many of us, it's in the development of APCDs, and for those of us that have existing health data infrastructures, it's in addressing key issues like standardized data collection, validation and data release, data linking and integration, the impact of both the Gobet decision and 42 CFR Part 2. These are the issues that many of you have asked NAHDO to continue to provide leadership on in the form of a convener, educator, advocate, and subject matter expert. Under Norm's guidance and with the support of the NAHDO board, our members and key stakeholders, NAHDO looks forward to defining a refreshed value proposition that will re-energize our commitment to engaging all parties and recognizing the specific challenges in these areas and doing something about it in a feasible and sustainable way. We are all being asked to do more with less. Now more than ever, we need NAHDO to keep us connected, to share best practices and experiences with one another, and to help us leverage our shared goals and collective influence in the same direction, to take healthcare data and its use into the next generation. We hope that the speakers and sessions provide you with the insight and information that you can take back and apply to your work, and provokes questions that will lead to more discussion both internally and within your larger networks. We hope that you take advantage of networking through the tools Norm described, definitely different in a virtual environment, but doable and so important as we work to strengthen our health data community. Finally, we'll take time to honor the achievements of several of our colleagues with 2 award presentations, Innovation in Data Dissemination and the Elliott M. Stone Award. On behalf of the NAHDO Board of Directors, we thank you again for taking your time to be part of NAHDO's 35th annual meeting. And with that, Norm, let's get started.
Thank you, Karynlee. We will now transition directly to our first plenary session. I would like to ask all attendees to please return to the lobby and join the next session. We'll see you there and we'll start in about 2 minutes. Thank you, everyone.